Gastrointestinal bleeding is a common occurrence in the population. When we talk about gastrointestinal bleeding, we are talking about bleeding from the gastrointestinal tract. And this can be obvious blood, which we call hematemesis, which is vomiting blood. You can also have occult blood, which is bleeding from the gastrointestinal tract, but it's not obvious. There's no obvious blood in the stool, but the stool could be tarry colored. And we also have hematochezia, which is blood in stool. And then you can also have melena stool, which is tarry colored stool because of blood. So the bleeding can be from the esophagus, can be from the duodenum, and it can also be from the stomach. When we have bleeding from the esophagus, the stomach, or the upper part, up to the second part of the duodenum, we talk about upper gastrointestinal bleeding. And then when it is from the lower part of the duodenum to the ileum and the large colon, then we talk about bleeding from the lower gastrointestinal tract. So when we talk about the upper gastrointestinal bleeding, we are talking of bleeding from the esophagus. Bleeding from the esophagus can be from esophagitis, and the esophagitis is inflammation of the esophagus, which can be due to inflammation from infections. We have fungal infection, you can have viral infection, and then you can also have gastroesophageal reflux disease causing bleeding from the lower part of the esophagus. We can have tears from the esophagus, which can be caused by excessive vomiting or excessive overeating, causing persistent vomiting and also lashing. Then we have esophageopharesis, which is accumulation of blood in the vessels on the lower part of the esophagus, which is as a result of portal hypertension. Portal hypertension is a condition that happens when there is an increase in the pressure in the portal vessels, the blood returning blood from the lower gastrointestinal tract to the liver due to liver cirrhosis. Then you can also have bleeding from the stomach, which could be due from peptic ulcer disease. You can also have gastritis, which is inflammation of the wall of the stomach. You can also have gastropathy, which is leadening and the leadening of the blood vessels and the permeability of the vessels of the stomach. And you can also have what we call the Floyd's syndrome, which is extensive thinning of the blood vessels in the stomach due to various arteriovenous diseases. Then you can also have bleeding from the duodenum, which could be due to duodenitis, which is inflammation of the wall of the duodenum. You can have gastric, you can have peptic ulcer diseases, where we have ulcers on the duodenum affecting the various part of the duodenum. And then you can also have gastropathy due to various blood malformations in the duodenum. So bleeding from the lower part of the gastrointestinal blood is any bleeding from the ileum and the large colon, which is composed of various parts. And this can be to inflammatory bowel disease. You can also have bleeding from infections like E. coli. You can also have bleeding from the colon, which is commonly due to what we call mucous diverticulum. Diverticulum or diverticulosis is an outportion of the wall of the large intestine due to various causes. Then you can also have Crohn's disease, and you can also have bleeding from the lower part of the colon, which could be due to polyps, could also be due to colorectal cancer, and you can also have bleeding from the anal region, which could be due to anal fissures, which is various cuts on the lower part of the anus, and also you can have bleeding from hemorrhoids. So how do we evaluate people who present to the health system due to gastrointestinal bleeding? The first thing is the history. You want to know how much the bleeding has, how long has the bleeding been there, what are the other associated symptoms, are there changes in appetite, does the patient have any other medical problems, and you also would want to rule out other possibilities of bleeding from systemic diseases. Then you want to establish the stability of the patient, because sometimes if you have excessive bleeding, this can be a life-threatening condition, and you need to be sure that the vital signs of the patients are okay. And if the patients have been excessively vomiting blood, then you want to resuscitate the patient. Resuscitation means you establish 2 large lines so that you give IV fluids, and then you take blood for group and close match in case the patient needs transfusion. And then you also want to do blood tests, which include complete blood count to see what is the level of the HB. And also you want to do liver function test because of the other bleeding problems. You want to do the coagulation profile, and you also want to do something we call INR, which shows how well the clotting system of the patient is functioning. Then if you're not very sure whether the patient is bleeding blood from the stomach or is it from the upper respiratory tract, then you can do gastric lavage to establish the level of bleeding and the presence of persistent bleeding. Other investigations include an endoscopy, which is a tube is put from the patient's mouth up to the stomach. This will help you identify the source of bleeding, and if you identify the source, you can still use the same endoscopy to do banding or sclerotherapy for the bleeding vessels. And you can also do a biopsy of if you find an ulcer or an abnormal lesion in the stomach, like patients who have gastric cancer. Then you can also do a colonoscopy, whereby the pipe is put now from the anal region going up through the colon and checking the various parts of the colon. So these are some of the investigations that you can do when patients present with the GI bleeding. The treatment is usually, first of all, you stabilize the patient, make sure that the vital signs, the blood pressure, the pulse are okay, and if he has any hemodynamic compromise, then you resuscitate patients with the IV fluids and also blood transfusion if necessary. Then the other interventional studies like endoscopy, colonoscopy will help you to either do a biopsy or also treat the cause of the bleeding. You can also, if you are not able to establish what is the cause of the bleeding with endoscopy or colonoscopy, a CT scan of the abdomen and a CT angiogram can also be done, and this will help you to identify the vessel that could be bleeding. And this is usually more if the bleeding is from the lower part of the intestine. So the treatment is dependent on what is the exact cause of the bleeding. And most of the time is to stabilize the patient. Sometimes if you find bleeding from peptic ulcer disease, then using drugs we call proton pump inhibitors will help control the bleeding. And if the patients are unstable, then blood transfusion might be necessary. And if the bleeding is from polyps from the colon, then doing what we call polypectomy, which is removal of the polyps, could be helpful. And of course, colonoscopy can also be done to rule out the possibility of colorectal cancer and treating appropriately. Thank you for listening. I welcome you to our next talk, which will be on the process of endoscopy. Thank you for listening.